Hello, everyone. Welcome. Thank you so much for joining us today for our first Data to Drive Decision webinar of the new year. Today, our topic is going to be telehealth in Colorado, advancing access to essential healthcare services. My name is Clare Leather. I am the Public Reporting Manager here at CIVHC, and I am joined today by two fantastic presenters, Ashley Heathfield from the Office of eHealth Innovation, where she is a Senior Project Manager. Ashley is going to be speaking to us today about the multiple efforts from that office that office has taken on to continue to increase access to telehealth services and reduce health inequity barriers. We are also joined by our very own Emma Anderson, a healthcare reporting analyst at CIVHC. She is one of the lead analysts that helped create the telehealth analysis report that we also will be reviewing today. She's going to be demoing the report for us and sharing all the cool new features. And I'll round out the bunch by sharing some insights and findings from that report Emma will discuss today. So some housekeeping items before we jump in. All lines are muted, but please feel free to jump into the chat box with any of your questions. This is meant to be an interactive experience. We'll have some poll questions for you guys, and we will have a dedicated Q&A session at the very end with about 10 minutes to spare, and we'll hopefully address all the chat questions then. This webinar is being recorded, and the slides and the link to the recording will be posted on the events resource page on civhc.org. So just really briefly, a little bit about CIVHC for those of you who may be new to us, joining us for the first time. Our mission is to empower individuals, communities, organizations through collaborative support services and healthcare information to advance the triple aim of better health, better care, and lower costs. We are a nonprofit and we are nonpartisan and objective, and we really pride ourselves on that. So who we serve a wide array of stakeholders that we call change agents. These are folks who have boots on the ground, who are the ones working to make a difference in healthcare. So those could be individuals, employers, researchers, nonprofits. But as you can see from this visual, at the very center of all of that is the consumer. And that is ultimately where all of our activities are aimed to bettering the lives of Coloradans. And that's what really guides all of our work. So today we're going to be talking about data that is in the Colorado All-Payer Claims Database. CIVHC administers the Colorado APCD, and this is a database that has 870 million claims plus. It represents 36 commercial payers, including Medicaid and Medicare, 5.5+ million lives, including 50% of the self-insured. And we have nearly 70% of the covered lives, medical insurance only represented in the database as well. And we also have trend information that goes back all the way to 2013. So a really, really, really robust data set. So what's not in the Colorado APCD? Very briefly, federal programs, majority of ERISA-based self-insured employers, uninsured and self-pay claims, and supplemental info. So what do we do with all this great information? We turn it to both public and non-public data releases. So I am on the public reporting team where we identify opportunities for improvement and in our communities through interactive reports and publications. We also have a non-public data release side that license data to change agents that are working to advance the triple aim and that meet specific project needs. Today, we're going to be talking about both kinds of data, which is going to be great. You'll get the whole gamut. So this is the agenda for today. This is what we're really trying to cover. So first thing is understand how the use of telehealth services has changed since the onset of the pandemic. We want you to learn what types of telehealth services Coloradans are accessing. We want you to identify how provider payments compare for telehealth versus in-person services, so that parity element. And we also want you to understand state efforts to reduce the telehealth barriers, improve access, and address health inequities. So we'll start off our presentation with a poll question, sort of a table setter. Have you used telehealth services since the onset of the COVID-19 pandemic? So we'll give you about 30 seconds to respond. It looks like a majority of you have, about 78% compared to 23%. Thank you for participating, and that's a great table setter. So lots of us using telehealth after the pandemic. So we will get into our telehealth services analysis. So the goal of this report, we really started reporting with the Governor Jared Polis's executive action that happened in April of 2020, expanding the definition of telehealth. And since then, we've been reporting and analyzing telehealth data. The goal of our report is to provide stakeholders with information to help understand telehealth services prior to the onset of the COVID-19 pandemic and the impact the pandemic had on telehealth services use. The current report provides data from January 2019 through January 2022, and really provides a great snapshot of what happened before, during, and after the pandemic. Before we get into the demo, I do want to discuss some parameters. We use two definitions for our telehealth services analysis, telemedicine and telehealth. And Emma will sort of go through that when she talks about the report and demos it for you, because you can select between the two. And these are the questions that we use to help guide us in creating the report. So this is sort of what we used, and this is what we hope you can answer when you use the report yourself. So with that being said, I'm going to stop sharing my screen and pass the baton off to my colleague, Emma Anderson, to demo.
Thank you, Claire. Okay. Hello, everyone. I am going to do just a quick walkthrough of each of the dashboards in this report, paying special attention to any changes or new features that were implemented in this latest version. First things first, how do you get to this page? When you get to our website, up here in the header, you'll go to Get Data, and then it's under Public Data, Focus Areas, and then second to the bottom, Telehealth Services Analysis. Lots of information on this page to give you some context. We also have some infographics that give you some high-level insights, but scrolling down to the bottom is where you get the interactive report. The newest version, first, what I want to discuss is our new table of contents cover page. Since this is such a large report, we really wanted to improve the navigation. So this page gives a quick high-level overview of what information can be seen and explored on each dashboard, and you can quickly navigate to specific dashboards using these arrows. Within the actual report, we added navigation buttons along the top of each dashboard, so you can move from page to page easily, and you can also navigate back to the table of contents when needed. Getting into the heart of the report, we'll start with this overview page where you can view and play around with some key metrics related to telehealth usage in Colorado. Every dashboard has these global filters at the top, which control all the metrics and the visualizations and the tables within the dashboard. And for this updated version, we did add some really simple information icons, which contain just more information, context, and definitions you may need regarding the possible selections in these filters. So this one, for example, gives you that overview of what Claire pointed out earlier, the difference between telemedicine and telehealth, and you can filter the dashboard by these selections. We also made the key metrics on this page more prominent and easy to read, so you can get a quick snapshot of telehealth spending and the volume of services. And then the bulk of the information is presented in the lower tables and the county level map, which remain consistent from our previous version. In the tables, you can see the diagnoses most common amongst those who utilize telehealth services, what kind of services they were provided, and what kind of providers were most commonly seen for telehealth services. And then just a reminder about one more important functionality on this page. You can select a county in the map, and it will filter the data throughout the rest of the dashboard. So for example, here we are now just isolating Larimer County and seeing their data and their telehealth information. Next, we'll
Quick
use
question for you, Emma, about the dashboard from one of our participants. The most recent data we can see on the dashboard is in January of 2022, yes. Correct?
Yes, great to point out. We have updated the data. It is much more up to date. And you can select very specific time periods using this slider too. So you can view what the trends look like after the implementation of Polis's policy. Before, you can really control that in a very finite way. Okay, next we'll use our improved navigation here at the top to head to the services detail page. Here again, you can see we have our global filters up top, and the bulk of the dashboard presents a more comprehensive picture of those top telehealth services, the diagnoses amongst those who use telehealth services, and the top provider types. Now, we received a lot of feedback that while this page has a lot of useful information, it was a bit difficult to use and understand in the original version. So for this reason, we implemented a few helpful improvements here. First, clear instructions on the page to explain the interactive functionality. We also added text into that table headers, which allow you to more clearly see what selections have been made, and a reset button to quickly clear those table selections that you made. And then just a reminder for the functionality on this page that multiple selections can be made with these three tables. So you can get really nitty-gritty with what you want to see by combining these selections. One example would be if I want to see for those who had a mental health condition and then saw a primary care provider for telehealth services, those services were often most related to evaluation and management. So that's how you can utilize this page to really see some specific details on telehealth usage. The next dashboard is entirely new, this demographics focus, and it shows the demographics of the population who's utilizing telehealth services. We still have our global filters up top, and then the user also selects the demographic category. We have patient age, race and ethnicity, and sex that you would like to explore. For each demographic category, this page lets you view and compare service utilization and telehealth costs, as well as the top diagnoses amongst that population who received telehealth services. One important piece of functionality I want to point out on this page is that you are able to select a demographic group in the bar chart, and it will filter the trend chart below, so you can more easily isolate that specific group and see their trends over time. And lastly is our telehealth trends dashboard. This dashboard looks quite similar to the previous version of the report. This page will give you a high-level view of telehealth services or costs with a particular focus on the trends over time. So you can see how you can select a specific measure here. There's a few to choose from that you can see in the line chart. And then the main update to this page was moving some critical information to the hover over. in the line chart. This more clearly displays exactly what you're looking at and helps to provide some context for that data point. In the last version, users, they were able to select one or multiple points, and then a table would pop up next to the line chart. It quickly got very overwhelming and cluttered and confusing, so we simplified it. You can select a point, you hover over it, and you're able to see all that pertinent information. So unless there's any more questions, I can't see the chat box right now, but that was the 1,000-foot view of the updated telehealth report. You can see there's lots of interactivity. We tried to make these things clearer, simpler, and more user-friendly. And we really just encourage you're taking some time to play around with it and explore the data, and please ask questions as needed. Thanks.
Yeah, I was going to ask if you could zoom in just a little bit so we could see the hover over a little better.
Oh yeah, of course. Thank you. Is that a little clearer?
Yeah, it's a very cool breakdown. So I just
and what we added here specifically was being able to really easily see that change from the previous month, which was difficult to see in the last version. And then you can also see the top procedures for that specific month.
Awesome. Thank you so much, Emma. I don't see any more questions, just some compliments, which is nice. Thank you. We're excited about this analysis and hope you can play around.
Oh, Claire, you're muted.
Oh,
you're back.
Okay, I'll share my screen. Oh, here we go. Here's another question. How were you able to capture telephone services? Was it common for payers to include this information? Speaking of Medicaid, it's not something that's available in our data just yet. Do you recall if the codes included? Yeah, if the codes included telephone services.
You know, I don't know the answer off the top of my head because we identified these services using CPT codes. So I would just have to go and look at those specific codes, which I can do. I'll let you know.
Great. So we'll circle back with you on that one. Thanks so much for your great questions. We have a question for you now too. So since you've seen this report, we'd love your feedback to understand sort of what categories or features would you find valuable in future iterations. So please take a minute to reply to our poll. Okay, it looks like a majority of you were interested in looking at the social determinants of health, and that was closely followed by rural versus urban counties, two things that are definitely on our radar. So thank you for answering our full question there. I'm going to talk really briefly about our findings from this report. So the banner headline is the number of telehealth visits increased dramatically post-pandemic and still remains high. So 2,000% increase from 2019 to 2020. We've seen a slight decrease of about 11%, but again, really still seeing one visit per person from 2020 to 21. So seeing that sustained usage. Telehealth Medicaid visits increased the most across all payers from 2019 to 2020. But again, we're seeing a decline for all payers from 2020 to 2021, the exception being commercial insurers. So commercial insurers have seen a slight increase. So what are people using telehealth services for? A majority of folks are getting services for mental health. That is the top telehealth diagnosis category for all years, and increased both in 2020 and 2021. It's also the top service for top diagnosis for all age groups, except for people 65 and older. So 75% of all telehealth visits were for mental health in 2021. This is an interesting chart. It shows this is an interesting infographic, excuse me. It dives a little deeper into the different diagnoses here that we can see the breakdown, sort of the top three. So we know mental health has been predominant, but it's also interesting to see the changes in the second and third top diagnosis categories. 2019 had respiratory and circulatory diseases, and 2020 and 2021 are seeing more endocrine nutritional diseases along with multiskeletal and nervous system diseases. So these categories have shifted almost every year. So that's interesting. And then lastly, trends. So we have found that telehealth visits for behavioral health providers have remained high and have actually been sustained over the years, while visits with PCPs have dropped more. So this is a trend we're seeing for many other providers, but behavioral health providers in particular have that sustained growth, while other providers are seeing a slight drop off, like PCPs. So with that being said, I'm gonna pass the baton off to Ashley so she can talk a little bit about the efforts from the Office of eHealth Innovation. So Ashley, take it away.
Thank you, Claire. So I'll be sharing who the Office of eHealth Innovation is, our role in telehealth during the COVID-19 response, and how we're approaching telehealth currently and into the future. So if you can go to the next slide. So a little bit about our office. We were established in 2015 through an executive order responding to the consensus between public and private stakeholders of a need for statewide health IT governance and coordination. Housed in the Lieutenant Governor's office, our team is responsible for defining, maintaining, and evolving Colorado's health IT strategy concerning care coordination, data access, health care integration, payment reform, and care delivery. So to ensure these efforts align with the wants and need of Coloradans, OeHI has created and adheres to a health IT roadmap. And we also have our beloved eHealth Commission made up of experts across Colorado's health IT landscape, which advises on our direction and steers the roadmap efforts. The roadmap identifies three major goals to guide our work for the next few years, and that is Coloradans, community partners, payers, state, local, and tribal agencies share data and have equitable access to needed health and social information. That Coloradans can access high quality in-person, virtual, and remote health services that are coordinated through information and technology systems, and that Colorado improves health equity through inclusive and innovative use of trusted health IT and digital health solutions. Next slide. So as part of Colorado's response to COVID-19, OeHI worked to expand access to telehealth resources for Coloradans and providers, leading the Innovation Response Team Telemedicine Task Force, or the IRT, facilitated a leadership team to drive telemedicine technology, policy, and communications efforts, and worked with the Governor's Office and the Department of Public Health and Environment to add information about telehealth and what options existed for Coloradans and health providers. So as part of this, OeHI helped to draft Executive Order D 2020, signed in April 2020, that temporarily suspended the definition and exclusions of telehealth under the Colorado healthcare insurance laws to expand the scope of telehealth that expanded the scope of services that could be provided via telehealth during the pandemic, including the addition of voice-only communication, text messaging, and expanded out-of-state telehealth provider licensure exceptions. OeHI was also consulted on Senate Bill 2212 that was signed in July of 2020, Claire mentioned earlier. This bill prohibited all health insurance carriers from imposing specific requirements or limitations on HIPAA-compliant technologies used to deliver telehealth services, from requiring a patient to have a previously established patient-provider relationship to receive telehealth services, and from imposing additional certification, location, or training requirements on providers in order to be reimbursed for telehealth services. And then specific to Colorado Medicaid, SB 2212 mandated that the State Department reimburse rural health clinics, federal Indian health services, and federally qualified health centers for telemedicine services provided to Medicaid recipients at the same rate as the delivery of in-person services, and expanded the definition of healthcare to include health services such as speech therapy, hospice care, and more, which made more provider types and services eligible to be reimbursed when delivered via telehealth. And finally, as part of the IRT, OeHI set up the Health at Home website So this website was designed to inform Coloradans of their options in receiving care virtually, whether they have a provider and health insurance or not. OeHI continues to keep this website updated with relevant resources and showcasing organizations that can provide care virtually in Colorado. Next slide. So OeHI also funded 34 Medicaid telemedicine projects across the state at the end of 2020, totaling about $2 million. The projects included innovative solutions to divert emergency department visits, increasing provider capacity through virtual care, and remote patient monitoring. Next slide. So OeHI also worked to collect insights, challenges, barriers, and successes of telehealth in Colorado to help inform future efforts. Our team partnered with Colorado Health Institute to examine the value proposition of telehealth services in light of the COVID-19 pandemic and Colorado's rapid transition to virtual care delivery. So CHI developed an analysis plan that utilized key informant interviews and electronic health record data from the Colorado Health Observation Regional Data Service, or CORDS network, to answer key questions related to utilization and access, outcomes and quality, and provider and patient experience. So this resulted in 3 reports, one examining patient experience, including benefits and barriers, another on provider preferences and barriers to adoption, and lastly, a report looking at the utilization of telehealth and who was and wasn't using it. To dig more into the provider and community partner needs and experiences with telehealth, OeHI partnered with Prime Health to establish the Regional Telehealth Learning Collaboratives, or RTLCs. So the goal of these groups was to advance the statewide adoption and coordination of telehealth technologies. They convened from April 2021 to June 2021 and included 3 geographic regions spanning urban, rural, and frontier areas, each served by a regional accountable entity that encouraged participation among providers and community partners alike. So through this effort, OeHI and Prime Health were able to listen to hundreds of individuals and dozens of organizations statewide, gathering information, discussing models and services, collecting feedback, and determining priorities, and concluded with the delivery of collaboratively developed recommendations for an equitable, impactful, and inclusive statewide telehealth infrastructure. And then finally, through a collaborative effort led by OeHI and Prime Health again, a survey was developed that included insights and questions from more than 25 state departments and agencies, research organizations, provider organizations, and community partners. An initial survey was disseminated in 2021 and was followed up by one in summer 2022. So the wealth of information gathered from these surveys responses has and will continue to be leveraged to inform future decision-making in support of advancing equitable statewide telehealth access, adoption, and sustainability. So you go to the next slide. So I shared a lot about the different projects that OeHI did up until 2022. And now I'll dig into what came out of those projects and what we learned. But before I do, we're going to launch another quick poll. So if you've used telehealth before, what barriers, if any, did you encounter? So yeah, give folks 30 seconds or so to fill that out. All right, so it looks like majority of folks, bad internet or phone connection, which leads us right into the next slide there. So the result of all of these different efforts helped OeHI and other stakeholders to further understand barriers patients face in utilizing telehealth, and also the barriers providers face in adopting, implementing, and sustaining telehealth care delivery. And similar to y'all, across all of our projects, we found that for patients, a lack of reliable, affordable internet was and continues to be the most reported barrier, followed by access to technology and digital skills. In addition, the CHI reporting mentioned earlier found that while most patients reported less travel to the doctor, more options for providers, and generally feeling pretty positive about telemedicine, they also reported unclear expectations for communication, limited experiences with the new technology that telemedicine introduced, and that cost influenced access to telehealth services, such as the cost of the internet, data plans, and phone minutes. These challenges likely contribute to the adoption differences CHI found in their analysis of the CORDS network data, that there is lower utilization of telehealth in rural areas by older adults and Black and Asian Coloradans. Next slide. So moving to the barriers healthcare providers face in implementing and sustaining telehealth. Through the RTLC work, Prime Health identified over 25 different organizations disseminating telehealth information and training to Colorado safety net providers, but with little coordination with one another on topics or sharing resources, funding, and information. They also found that several of these organizations were sharing incorrect or out-of-date information that was misleading or potentially harmful to providers. RTLC stakeholders were not able to identify a go-to resource in Colorado for telehealth information and training. And in fact, many reported difficulties in this area, citing confusion, duplicative programming, credibility questions, and time-consuming yet ineffective trainings as barriers. The 2022 Colorado Provider Survey that we did indicated that training remains the top resource need identified by all participating providers, regardless of whether they are currently utilizing telehealth or not. And in both the 2021 and 22 surveys, a lack of training was the #1 reason preventing providers from starting to conduct telehealth visits. The RTLC also found that many providers reported complexities, challenges, and claims denials for unclear reasons when attempting to bill for telehealth, and particularly confusion when it came to contracts with commercial payers. Safety net providers often rely on reimbursement from commercial payers to sustain their practices, so complex billing practices that are costly and time-consuming can lead to adoption and sustainability issues for these practices particularly. Many safety net provider organizations, particularly those in rural areas, also reported challenges with using outdated electronic medical records or EMRs that do not easily integrate new technologies, or that add-ons such as patient portals, billing and quality reporting features, or health information exchange integration are incompatible. So with so many pain points related to dysfunctional EMRs, stakeholders reported that it was difficult to consider prioritizing and investing in digital health technologies when fundamental priorities have not yet been resolved for them. And finally, providers also reported procurement challenges related to choosing which vendor is right for their organization and just feeling overwhelmed sorting through the wide range of tools, vendors, and services in the digital health private sector. Additionally, providers reported that it is difficult for smaller organizations to attract or contract with vendors if they don't have a certain threshold of patient volume. So providers expressed a need for technical assistance and procurement support to streamline solution architecture and minimize the number of different tools that their staff are expected to use in their work. Next slide. And then you can actually jump to the next one right after that. So as we look beyond the pandemic and the lessons learned from earlier work, OeHI is focusing our telehealth work through 3 buckets: research, support to Colorado healthcare providers, and strategic partnerships. We want to further the state's understanding of what is needed for all Colorado communities to have the ability to benefit from telehealth services, also supporting Colorado providers and sustaining the delivery of telehealth services in addition to their in-person services, and partnering with other state agencies and efforts that will lead to more equitable access to telehealth. So throughout our past work, we've been able to make data-informed decisions about how to approach our current and future efforts, which I will dig into now. If you go to the next slide. Oh, perfect. So in response to barriers identified from earlier projects, as well as continued gaps in understanding, we have initiated and completed several research projects. Again, we surveyed Colorado providers in 2022 as a follow-up to the 2021 survey, just to continue our understanding of what is needed to expand and support telehealth services in Colorado from that provider perspective. OeHI and the Healthcare Policy and Financing team partnered with Colorado Health Institute on a research brief to examine the effect of remote patient monitoring, or RPM, on particular health outcomes, potential cost savings from RPM, and operational considerations for providers considering implementing RPM, which includes evaluating vendors and best fit for one's organizational goals. This was particularly exciting as HCPF continues to contemplate expanding their RPM benefit beyond home health agencies to other provider types. So we are also partnering with the Colorado Anschutz Medical Campus on an evaluation tying outcomes and notable differences based on payer source and population between virtual care and in-person visits. So this includes the breakout of telehealth modality utilization and analysis on equality of telehealth access within the CU School of Medicine patient population, and recommendations on increasing equitable access to telehealth in the state. And we anticipate having that report ready by June later this year. OeHI is also sponsoring telemedicine questions in the 2023 CHAS survey to continue our understanding of patient perceptions and barriers to telehealth usage, particularly as in-person health services increased from the start of the pandemic. And this brings me to the two exciting projects we've got with CIVHC specifically, which I'll dig into on the next slide. Thanks. So as you heard, providers have reported challenges and claims denials when attempting to bill for telehealth, particularly with commercial payers. Additionally, respondents to both Colorado provider telehealth surveys indicated that low or no reimbursement is challenging, with 19% of respondents to the 2022 survey indicating that it would not be easy to continue using telehealth in a way that is financially viable for their practice. Parity for telehealth services has been in place in Colorado since 2017, and in 2020, Colorado expanded parity further. So therefore, OeHI has partnered with CIVHC and the Department of Insurance to analyze both Colorado APCD data and data collected by the Division of Insurance from 5 commercial payers, with a goal of investigating if the legislation was indeed resulting in payment parity between in-person and telehealth services in Colorado, and if there's parity in the rate of claims denials for telehealth compared to in-person services. So we're still in the midst of this project, but here are some of the findings from the Colorado APCD data. Payment parity between in-person and telehealth claims is complicated. Some service categories show a decrease in an allowed amount for telehealth versus in-person claims, while other service categories show the opposite. However, the median allowed amount of reimbursement for in-person services in 2021 was 133, compared to a median of 110 for telehealth services across all service areas and payers included. In 2021, the allowed amount for telehealth services either increased or remained the same for all service categories compared to 2020. This potentially indicates that the policy revisions and additional guidance from DOI are having an effect on telehealth reimbursement year over year, but more analysis is needed. And finally, rural claims had a higher allowed amount of reimbursement than urban designated claims across most service categories, ranging from 17 to 21% higher. So this has been a really exciting and wonderful partnership with CIVHC and DOI, and I'm very grateful that we'll have a completed analysis of both telehealth claims and denials data for 2020 and 2021 by this summer. The second project is the community level telehealth analysis, which CIVHC is working to build out currently. And this will be a person and census tract level analysis of telehealth and in-person utilization to understand indicators of access barriers beyond broadband, disparities in utilization at a more granular level, and will include tying a variety of known access barriers with different demographic groups. So the real aim of this analysis is to dig into inequities in telehealth access and adoption, and then in turn guide interventions and programming to create more equitable access. Next slide. All right, so now I'll dig into the OeHI projects that are supporting providers. So as shared earlier, the 2021 Regional Telehealth Learning Collaboratives identified a need for a go-to resource in Colorado for telehealth information, training, workforce support, and resources. This recommendation was included in the 2021 Colorado Health IT Roadmap Update, and OeHI is tasked with the creation of a Colorado Health Innovation Resource Platform for providers and community partners to access trusted information, resources, and support for health IT, virtual and remote health services, and other digital health solutions. So Prime Health is currently working on requirements gathering and plans to have a draft logistics plan for CHIRP, as we're calling it now, by spring 2023. So the House Bill 21-1289 directed the Colorado Broadband Office to award grants to providers of telehealth services. And so in partnership with OeHI, 10 organizations were chosen for funding, totaling roughly $4 million. The funds are going to support organizations in bolstering their internet connectivity, lending devices to patients so they can access care virtually, and implement additional virtual care service lines such as remote patient monitoring. The 10 awardees serve 36 of Colorado's counties and include a variety of organization types and populations served, such as low-income children and their families. There's critical access hospitals and emergency service as departments in there. Next slide. All right, so moving into our last bucket of work, strategic partnerships. OeHI, the Office of Future of Work in the Colorado Department of Labor and Employment, and the Colorado Broadband Office are working in partnership on the Colorado Digital Equity Planning Grant, a one-year opportunity to create a digital equity plan for our state. This partnership was born out of funding made available from the Federal Infrastructure Investment and Jobs Act, which dedicates $2.75 billion for grant programs that promote digital inclusion and equity to ensure that all individuals and communities have the skills, the technology, and capacity needed to reap the full benefits of our digital economy and society. The planning grant focuses in on the 8 covered populations, which are listed on the right-hand side of the screen, or the slide. And the intention is that this plan impacts and interacts with Colorado's economic and workforce development goals, educational goals, health outcomes, and civic and social engagement. This is a really exciting opportunity for state agencies and community organizations across different sectors and across the state to come together and create a plan that improves equitable access overall. And to inform this work, several committees and work groups have been formed. So if you're interested in joining the Digital Equity Committee, you can complete the form linked on the slide. I'm assuming the slides will go out afterwards, or reach out to the Office of Future of Work's Digital Equity Program Manager, Melanie Coletti, and I'm happy to put her email address after I wrap up in the chat. So finally, through a collaborative partnership with OeHI and HCBA, a state-funded telehealth project dashboard was developed to provide information on state-funded telehealth activities and interventions occurring throughout the state. The intention of this dashboard is to support state agency coordination and collaboration on telehealth funding and programs, and is meant to help track, analyze, and plan state telehealth programs and projects with this overarching goal of equitable distribution of resources and support across our state. And I believe that wraps up my part of the presentation. So I'll hand things back over to Claire. Oh, if you have more information, you can go to our website, which is linked here.
Thank you so much, Ashley. That was so helpful. So much great work you guys are doing. Yeah, just the number of efforts is amazing and wonderful. So love to see the collaboration also with Civic. So we'll start answering some of your questions. I'll work from the earlier questions. I feel like there have been a lot of questions about call centers. So I think Emma said that we use CPT codes in our telehealth analysis. And so we'd have to look into that. I don't know if call centers are part of that selection. Emma, I don't know if you have any other thoughts on call centers, but.
No, I'm actually not familiar with what's meant by call centers. So it's certainly something we can look into though.
Yeah, and we'll follow up. And someone also asked about the high demand for mental health providers and the burnout of those remaining. What about those retired, and how does that impact your metrics? So I don't really know how much it impacts our metrics to look at the folks that have been retired, because we just don't see that. But just anecdotally and from the data we've had all for many years now, behavioral health needs have been really at the forefront for all Coloradoans before the pandemic, during the pandemic, and after. So I think it speaks to that as well. Ashley, I don't know if you have any thoughts on that from your work.
No, I don't actually. But thank you for asking.
Yeah. Emma, I don't know if you want to chime in on that one.
The only clarification that might be helpful is to be considered a telehealth provider in our analysis. You needed to have provided at least one telehealth service. So that population would not include anyone retired or anyone who just didn't provide those types of services, even if they're an active physician.
Yep. And then someone gave us some great feedback on caveats, and we totally agree, and we try to put as many caveats in our data limitations as possible in our methodology and try to put them the front of the web page. So there's some caveats there, but I think we can always do better. So thank you so much for that feedback. Ashley put in Melanie's email there. Thank you so much. Here's a question, I think, for you, Ashley. Are there grant applications for the coming year, and how do we learn more about increasing funding for telemed?
Yeah, so we actually had a project we did with some students out of CU Denver, and they looked at all of the funding opportunities from both nonprofits and within the state of Colorado as well as federal opportunities. So that I think was added to our website this morning. It includes this really helpful Excel of where you can go to find information, not related to OeHI necessarily, but throughout the state and federally. For OeHI specifically, we are always kind of having conversations and trying to think how we can further support providers. So I would say the best place to we don't have anything coming up as of yet, but if you stay and continue to check our website, and we'll add opportunities that do come up there, but nothing on the docket just for the 2020, the rest of 2023 just yet.
Okay, any more questions? We are a little early, so any more questions? Okay. Well, seeing none, we're really thankful to our presenters, Ashley and Emma. Thank you so much for the great questions from the participants. Thank you so much to our behind the scenes team, Spencer and Steph, for setting this up and doing all the logistical work. You will all be getting a post-event survey. We'd love to hear your feedback on topics you may be interested in the year ahead. And we look for our future invitation for our upcoming webinars in February. Oh, we got a couple more questions. I should have waited longer. Sorry, guys. Based on overall understanding of feelings towards telemedicine, do you feel like the services and funding will be expanding and supported by commercial payers? Sounds like a good question for you, Ashley.
I can jump in that with this new data that we have now that we're seeing it through 2021, we're not going back to the practices from before COVID. I think that this is going to be a stable change. Obviously, we saw it dip a little bit as the world returned to normal, but it's not going to go back to what it was pre-COVID. So I absolutely could see commercial payers jumping on this and expanding it.
Yeah, I would just completely support that. I think there's only more innovation coming into the healthcare sector. And so I think as we, find that intersection of, better health outcomes, more access to healthcare services, decreased costs in the healthcare system, like this is going to just continue to be a part, an ever evolving part of our healthcare system now. So I would agree.
Wonderful. How do you see expansion of greater for supported telehealth oral healthcare? That's an interesting question. I don't know how much oral healthcare data we have. I don't think we have much. Like I can't recall. So Ashley,
yeah, I'll say that, so prior to this, I was at the public health, Colorado Public Health Department. And so I know the oral health team there was really interested in seeing how dental services could be more accessible through tele-oral health. So they've got a great team there. Ashley Kirk is, I think, leading that. And so I think watching from what's happening there in terms of, I know they've got a couple of pilots out, I think one's in Garfield County. So yeah, I think it's a space that is continuing to kind of expand and trying to figure out, again, just what makes sense from a team-based care perspective too, of how to support greater access to tele-oral health, or just to oral health in general through the use of telehealth.
okay, I want to wait a little longer so I don't cut anyone's great question off. Okay, I think we're good. There was a question about how we can see the recorded webinar, which is great. Recordings will be posted on our website, civhc.org, under event resources. The slide deck will also go out. And thank you so much. And I hope you all have a wonderful afternoon and stay safe out there and stay warm and dry. Thank you so much.